This patient has a severe anterior open bite. To set the IPR value, we will proceed with the final setup first. Apply extrusion by selecting multiple teeth in the mandibular anterior region. In the maxillary anterior region, we resolve open bite by applying negative torque by selecting multiple teeth. We apply IPR mainly on teeth number 40 with a lot of overlap. Before starting the layer, we apply 0.3 mm IPR between tooth number 41 and 42, number 42 and 43, and 0.4 mm IPR between tooth number 33 and 44, number 44 and 45. We will distribute the spaces created by IPR evenly. In the maxillar, we will expand and secure space for rotation. Align the teeth to the ideal arch in the rotation leveling layer. Adjust axis by moving the tip. Let's start to resolve open bite in layer 3. In the mandible, apply extrusion by selecting multiple anterior teeth. In the maxilla, apply minus torque by selecting multiple anterior teeth. We increase the setup success rate by applying divided movement value to multiple layers. We will adjust the teeth more delicately. We will distribute the movement value of layer 3 and apply them to layer 4. Completed the closing of canine teeth. We will design with the goal of closing the 4 incisors. We will close the space of the MN and MX and fine-tune the tip. Layer 6 is the pre-retraction stage. Apply retraction until all teeth reach the arch line. Fine-tune with checking the occlusal relationship. Finally, layer 7 is retraction stage. Evenly distributing the amount of overlapping teeth. It checks the amount of overjet and overbite and fine-tunes the teeth. After setup is completed, create steps using the superimpose function. In layer 1, tooth number 14 and 41 are the teeth that have moved the most. Divide the steps based on this. In layer 2, tooth number 23 and 32 are the teeth that have moved the most. Divide the steps based on this. In layer 3, tooth number 22 and 32 are the teeth that have moved the most. Divide the steps based on this. In layer 4, tooth number 21 and 32 are the teeth that have moved the most. Divide the steps based on this. In layer 5, tooth number 22 and 32 are the teeth that have moved the most. Divide the steps based on this. In layer 6, tooth number 23 and 41 are the teeth that have moved the most. Divide the steps based on this. In layer 7, tooth number 21 and 42 are the teeth that have moved the most. Divide the steps based on this. When applying extrusion, we will use attachments to give more force to tooth movement. In this case, we will use attachment from step 5. Select attachment for extrusion and attach it to the required anterior teeth. Rotate the attachment so that pressure is applied in the direction of the extrusion. Move it so that it is positioned about 1/3 of the crown. The size of the attachment will vary slightly depending on the size of the crown, but 2 mm in height and 2 to 3 mm in width are proper. The amount of protrusion is set to about 1 to 1.5 mm from the tooth surface to prevent the patient's sense of foreign body. Finally, check the number of aligners through Show All Steps function.